Hi, I'm Dr. Kathy Keller. I'm the president of Lake Medical Imaging here in Central Florida. I've been here for 35 years now, so it's a long time. Lake Medical Imaging has some unique challenges because of the age of the patients that we serve. Patients who are older are oftentimes have arthritis, are in pain, walk more slowly, maybe have hearing problems. So our technologists and all our staff need to take more time and care with them, realizing that they need that extra care. And we're very focused on that. Given the speed at which the Villages has grown, we have a big patient volume. So we've been looking for a way to maintain that level of care, concern, and personalized time, but still get things done in an efficient manner for the patient. I first found out about Subtle Medical when I was attending the RSNA at their AI showcase and was intrigued what could they do that made MR faster but still decent image quality. And I thought, well, this might be good for Lake Medical Imaging because we're growing so fast. After COVID, with the changes and all the lockdowns, we had a huge backlog of patients that needed to get their imaging done. And there just wasn't any way that we could manage that volume and continue to give the kind of patient care and time and attention that we wanted. So that was a huge impetus for us to get involved with Subtle. With Subtle, we were able to decrease the table time, so it was easier for the patient to hold still for a shorter period of time. Many fewer repeat scans. Better to stay on schedule and get through the day faster. Less tech overtime. Most important though, that we were able to maintain our patient-centered approach. Our throughput really increased tremendously because of the speed. One other thing besides the decrease in repeat scans because of patient motion is that on a 3T scanner, because of the more powerful magnet, you have more of the specific absorption of the energy that if you go beyond a certain amount that heats up the patient, it's not safe for the patient. So that will frequently make you have to stop and recalculate the protocol and change it so that you have a shorter scan time. Well, if you're already doing short scans from the beginning, you don't have the SAR problem. In fact, the techs call it you're being SAR'd out, which means you have to stop and redo things. So that problem has been eliminated, which is really terrific. We're doing about 7 more patients a day on the 3T scanner and 4 to 5 more patients a day on the other 7 scanners. So between all of our scanners, we're doing about 38 to 40 more patients a day. That's the same as having another MR magnet without having to purchase it. An MR costs what? More than $1 million. It's the service contract a year, more than $100,000, and then you need more tech. So to pay the small amount of money for the Subtle service has greatly increased our capacity. So our backlog in scheduling has gone down to almost nothing. Patients are happier when they get their problem solved sooner. Our referring doctor population is happier because we're able to take care of their patients sooner. And of course, I'm happier because the techs are doing fine, the patients are happy, and I'm not behind schedule. The collaboration between Lake Medical Imaging and Subtle Medical has really been great from the start. Once we decided to proceed, the Subtle Medical team came on site to our Brownwood facility and spent a whole day with the technologists so that they could best understand our workflow, see the kind of patients we have, the time it takes with the patients, see the different protocols, and really get an understanding of what we were trying to achieve. Then their technical support person, who is a technologist himself, he was able to look at the protocols with our lead MR tech and go through and talk together about where the best places were to apply the Subtle technology so that we could save time, preserve image quality. That was very important. We found that especially for prostate imaging, it cut a lot of time and also abdominal, and so that was very helpful. So with everything, we ended up using it on, I think, just about every protocol here. At Lake Medical Imaging, we have 8 different MR scanners. One is 3T and the rest are 1.5. And because we've been in business for a long time, they vary in vintage. It was important for me in partnering with Subtle Medical that the technology would be vendor agnostic so that we could use it across all these different platforms of different vintages and it would work. And that's what we found. Since we've deployed SubtleMR, I've been very satisfied with the ability to have many more patients done, happy patients, good patient satisfaction, techs are happy, costs me less, it's great. And what was nice with Subtle Medical is that they had a good system already in place for how to help a practice adopt their AI solution. I'm especially excited about some of the new things that Subtle Medical is bringing, like with the subtle gadolinium, where the dose of gadolinium can be greatly reduced and in some instances maybe not used at all. I'm really excited to be working with Subtle Medical and see what products they're going to bring to Lake Medical Imaging in the future.